Okay, so good afternoon, ladies and gentlemen. Thanks for joining us here in this afternoon grand round, which happens to be also part of the KKESH Global Education Forum. I'm so excited and thrilled to introduce to you our speaker today, Dr. Adi Al Owaifeer, who's an assistant professor of ophthalmology at the College of Medicine, King Faisal University at Al Ahsa. Dr. Adi completed his residency and fellowship at Riyadh, at which he was the chief fellow of 2019-2020 batch, and we were glad to have him as a graduate of Glaucoma division. Dr. Adi has a special interest in technology, graphic design, video editing, and web development. And he is the developer and designer of the website Glaucoma in Arabic. Recently, Dr. Adi joined KKESH again as a part-timer, and he's conducting some projects that are related to research technology. Dr. Al Owaifeer is going to speak with us or speak to us today about level up your technical skills during COVID-19, tips on how to make the most of your smartphone in ophthalmology. Dr. Adi, thanks for being with us. Please go ahead. The Zoom is all yours.
Thank you very much, Dr. Aweda, and I'd also like to thank the panelists with us, Dr. Conrad and Dr. Radwan. And I'd also like to thank Medical TV Division, the guys over there as well, Ali and Majid. And I'd like to thank all the attendees. I'm glad to see everyone coming over here and listening to what I have to say. I'll just start sharing my screen. Can you see my screen now?
Yes.
Bismillah ar-Rahman ar-Rahim. So there's no time in which utilizing technology is more important as compared to this time, which is the current COVID pandemic. And that's why I chose this title for this presentation, which is Level Up Your Tech Skills During COVID-19. Some of us are not that skillful in some of the skills related to technology and utilizing their smartphones. So that's why I figured I could shed some light on some apps and some ways you can utilize your smartphone better in your clinical practice. I'm going to talk about a lot of apps and a lot of companies in this presentation. I just wanted to mention that I'm not affiliated with any of them. And before I start, I'd also like to thank two of my colleagues that helped me during preparation of this presentation, Dr. Turki bin Dakhil, as well as Dr. Abdurrahman Badawi. And I'd like to thank all the attendees. I know nowadays people have been bombarded with online events and conferences and webinars. So people are calling to flatten the curve of online activities as well as the curve of COVID cases. During this presentation, I'll mention some apps and some references. I just wanted to tell you that you don't need to take note of the things that I'm going to mention, because I have a handout, a PDF handout. I'm going to share it with all of you via the chat here in Zoom. So just sit back, relax, and enjoy the presentation. Just before starting, having an overview about mobile technology, as you can see here on the left-hand side, people in the early 1900s up until 1970, 1980, people were using their phones for communication only. And then we had another line of digital devices, which was called the PDAs, or personal digital assistants. And those, if you remember, are small devices in which you record some of your contacts, some of your documents, and some of them had dictionaries, etc. And both devices merged into the concept of a smartphone in the early 1990s, where phones were not just used for personal communication, but had extra features, up until the boom in 2007, when all of you know Apple introduced the iPhone, which revolutionized the way smartphones, the way we interact with smartphones, in which there's a screen with multi-touch sensors, in which the functionalities of a smartphone has been expanded. And from that time point up until today, the utilization of smartphone within all industries has expanded, including us in the healthcare industry. This is a nice video. Before kicking off, I'd like to show it to you. It's called The Evolution of the Desk. This video shows you how much a lot of things that we used to do physically, now we do on our digital devices. For example, reading magazines now can be through Amazon. You don't need a dictionary, you have an online dictionary and a thesaurus. You don't need to scan documents with your scanner, you have your Acrobat PDF. You don't need to post blogs, you have online blog websites. You don't need maps, you have your navigation system on Google Maps. You don't need your calendar on the wall because it's already there on your phone. You don't need video communication with your colleagues because you already have Skype and Zoom. And you don't need your encyclopedia because you have Wikipedia, etc., etc. You don't need sticky notes because you can post your tweets on Twitter. You don't need anything to hold, you don't need a drawer to hold your files because they're all on the cloud. So basically all what you need is the digital devices that you have, your laptop and your mobile phone. And looking at us in the specialty of ophthalmology, this is our setup. And we hope that one day comes, all our setup gets stacked in some sort of a Swiss Army knife where a small device or a small gadget can, through that gadget, we can perform all the functionalities we need in an ophthalmic examining room. We're not there yet, of course, but with whatever smartphone technology we have right now, we can utilize some of the steps within the clinical encounter. So digging into the actual presentation, and this was the most difficult part for me actually, which is how to organize the data that I'm going to present. And I figured that I'm going to organize it into 6 categories. Those are apps and useful in your clinical encounter with patient. And then number 2, apps that are useful in management of certain diseases. And then apps useful in the OR. And then I'm going to talk about things that are useful to doctors in general in terms of productivity, how to connect with your patients, and how to maintain continuous medical education. So I'll start by first category, which is the clinical encounter. And I guess the $1 million question with the COVID pandemic in ophthalmology is, how can we measure visual acuity distance over distance? And are there any apps that are useful in that regard? And actually, there are some apps that have been developed. I guess the most famous one is called Peak Acuity. And this app has been developed by a not-for-profit organization in London, a doctor called Bastoras. And he is conducting services in remote areas in Africa, specifically in Kenya. And what he wanted is a small tool that helps him in measuring visual acuity outside the clinic. So that's why he developed this app, which is called the Peak Visual Acuity Testing App. And he compared peak acuity with standard ETDRS and Snellen acuity in a paper that was published back in 2015. And their results found that this scatter plot shows the difference between standard ETDRS versus the app. And you can see those blue dots are specific measurements for each patient. And most of them are within 1 line difference. So this app has been validated, and it's quite accurate in terms of measuring visual acuity. Of course, if you search the App Store, you can find many other apps. One is called iSnellen, iTest, iChart Pro. Those apps actually lack validation, so we're not sure how accurate they are. There has been a study in the eye back in 2015 that compared some of those apps, and they found that those apps have more than 2 lines of difference compared to standard methods of measuring visual acuity. And that the acuity or the accuracy of measurement is worse when the patient has vision worse than 20/60. So if you have a patient that has vision 20/60 or better, they are more accurate. So just to wrap up what I've said so far about measuring visual acuity, most of the apps lack clinical validation, and the only app that has been clinically validated is Peak app. Although probably you will not use those apps in your clinic, in your routine care to check visual acuity, but they might be useful in certain circumstances. If you want to have a rough idea about a patient's visual acuity and he's at home, in rural areas, or sometimes when you're in a general hospital and you're conducting ophthalmic examination bedside. Of course, in addition to measuring visual acuity, we can perform other tests, and there are plenty of apps over there that can give you the utility of measuring other indicators. This is one of the very useful apps. It's called Smart Optometry. Allows you to do an Ishihara test, a Warford dot, an Amsler grid, an OKN stripes, and the duochrome test. I guess from an ophthalmology perspective, the most useful test over here is the Amsler grid for patients with AMD, for example. Instead of asking the patient to print the Amsler grid and stick it on his fridge, you can instruct the patient to use this app to monitor his condition on a daily basis. So moving from performing tests to another useful utility of smartphones, which is photography. And clinical photography is an integral part of a clinical encounter between you and your patient. And we routinely send patients to the photography department to get their photos done. And this is a time and effort consuming for both the patient and the physician. So another technique that can be utilized is taking photos through your smartphone. And just to demonstrate to you, I'll give you 5 seconds to take a look at those two photos, one on the right-hand side and the other on the left-hand side. Those two photos, one of them has been taken with a slit lamp camera and the other one is taken by the smartphone. So just have a look and give it a guess which one was taken by a smartphone and which one was taken by a slit lamp camera. I hope you guessed it right. So this one is by smartphone and this one was taken by a slit lamp camera. As you can see, both photos are more or less similar. This is another example of a fundus photo, one by a smartphone and the other by a slit lamp camera. This is probably more obvious that this one on the left-hand side was taken by a smartphone. But as you can see from those two examples, we can take good quality images with smartphones, and it's not a difficult issue. There are plenty of ways, and you've probably seen people moving around with adapters and stuff like that. And there are plenty of ways through which you can take photos from the slit lamp. You can do it without an adapter. You can do it with a do-it-yourself adapter, and you can buy your own adapter from whatever's available online. And I'm going to quickly go through the 3 methods. The first and the most simple method is to do it straight from your phone through the slit lamp. And probably some of you have tried this before and did not get clear photos. So I'm going just to show you some of the tips that you need to take care of in order to get high quality images if you're going to shoot straight from the slit lamp through your phone. So first of all, you need to put on the diffuser on your slit lamp. And the second step is to turn the illumination on your slit lamp up until maximum. And then the third step, you need to turn the room lights off completely. And the reason why you need to do that is if you don't do it, you'll see your own reflection on the photo on the patient's eye. After that, you go to the patient and you adjust your view first. And once you have a clear view, you bring your phone close to the binoculars with the other hand holding the joystick. And as soon as you get a clear photo, just click on that snap button and you can have a nice photo. And you can see examples of different conditions taken through smartphones. Of course, this is not my personal video. Credit goes to a doctor called Dr. Papchenko. This video is available on YouTube. You can check it later if you want. Another useful technique people have been doing is to utilize the 20 diopter lens as a mirror and then use the illuminating light from your phone to capture photos. And it's very useful if you want to do fundus photographs and show patient quickly how the back of his eye looks like, whether there are some hemorrhages, cotton wool spots, for example, etc. This is a very quick and useful way to do it as well. And of course, there are certain do-it-yourself adapters. You'll find explanatory videos all over YouTube that show you how to, without buying anything, just some basic stuff, you can assemble your own adapter. If someone is interested in doing such stuff, you can check that online as well. And finally, what I'm going to talk about in this section about photography is purchasing your own smartphone adapter. And those adapters are basically small gadgets that you stick to your slit lamp, and then they allow you to place your iPhone in a stable manner, and they allow you to take the photo nicely and clearly. So whenever you're going to buy your own adapter, I'm just going to go through some of the quick features that you need to look for whenever considering an adapter. The adapter has to be universal. And what I mean by universal is that it fits all types of phones. You don't want to change your adapter once you buy a new phone. You want something that's durable, compatible with all slit lamps and surgical microscopes, and of course something that's lightweight. Some adapters are very heavy. And something that I want to advise you not to do so is not to go online and type in Google smartphone slit lamp adapters. The reason why I don't want you to do that is you'll find these results. You'll find adapters that are specifically designed for ophthalmologists. There's no problem with those adapters, but the only issue is that they're very expensive, starting from $200 and above. What I want you to do and what I advise is to buy adapters that are actually not designed and manufactured for ophthalmology only, but manufactured for many purposes. And this is the adapter that I personally currently use. It's called the Snap Zoom adapter, and it only costs $47 actually, because it was designed for universal use. You can use it on a microscope, on a telescope, on a binocular, whatever. And it also fits slit lamps and surgical microscopes, as I have tried it, and many of my other colleagues have also tried it as well. And the reason why there's a disparity in price, this is just for interest. Sometimes if a merchant emphasizes value in a product, he can just put a higher price on it. So if they are emphasizing value to a doctor or an ophthalmologist that will give you the ability to take photos through your slit lamp, the price tag will be much higher as compared to a regular adapter or a universal adapter that fits many devices. So where are we heading in terms of photography? Up until today, the smartphone photography still requires a healthcare professional to be there. We cannot have the patient himself at home take a photo of his eye because we still don't have sophisticated technology that allows the patient to do so. But in the future, you may not know. We may reach a stage where the patient takes a photo of his eye and then uploads it to an app where artificial intelligence can process it and give the patient an instant result. You never know, this might be anytime in the near future. And a relevant example actually that uses smartphone is a company called Remedio AI, and they published the results in JAMA 2019. What they do is that they have a camera. It's not a camera, it's actually an adapter that you plug your smartphone onto, and you take a photo of a fundus, and they have their own mobile application which automatically interprets the results of the fundus photograph, whether the patient has diabetic retinopathy or not. Of course, they sell their devices to healthcare professionals, to clinics where diabetic patients are, not to patients straight away because it's a bit expensive. And another interesting device, but this is currently under development, and the University of California, San Diego, which is an all-in-one device for remote examination. And the idea of this device is that just like those VR glasses, the device is given to the patient or shipped to the patient. The patient uses this device and attaches his smartphone and brings it closer to his eye, and you can have clear, nice slit lamp images of the patient's eyes, as you can see over here. But this is still under research and development. So we're done with the first category, which is how can we utilize our smartphones within the clinical encounter. Now I'm going to be talking about management of certain diseases in ophthalmology and how we can utilize some useful apps. And the first condition I'm going to talk about is low vision. And the things that I'm going to mention in low vision, probably patients with low vision know them better than we do because they utilize them on a daily basis. But I thought I'll mention them in this presentation, just in case you have a patient with low vision. Just ask him in your clinic, just ask him, make sure that he's using those features. First feature is, most of those features are actually built in within the smartphone. For example, the first feature is the voiceover feature, which has the phone read all the content that's on the screen to the user itself. So you can just activate it and then actually choose the speaking rate as well. This is really useful. And another useful feature within smartphones for patients with low vision is the zoom feature. And what it allows patients to do is you can have a zoomed section of your screen, just in case the patient cannot see letters that are small. He can just click on them, and then the window automatically zooms for him. A third feature that's really useful is audio description. Sometimes you find photos or videos online which have descriptions attached with them. So what this feature does is that it reads those descriptions to the patients with low vision. So again, you probably won't be using those features, but just make sure when you have a patient with low vision that he's using those features and benefiting from it. There are plenty of apps for people with low vision that are useful, but unfortunately, none of them are useful for Arabic-speaking patients. For example, this is an app that has been developed by Microsoft. It's called Seeing AI. And the idea behind this app is that you just show your camera whatever objects are in front of you, and it tells you through artificial intelligence what's in front of you. So if you have, for example, a lady in front of you, you just lift your camera, and then the app takes a shot of whatever's in front of you and automatically tells you there's a middle-aged lady in front of you and her hair is black, etc., etc. Before moving from low vision, I'd like just to mention the efforts of one of the social activists in our region. His name is Muhammad Saad. Some of you probably know him. He collaborates with our hospital a lot. And he is a technology instructor for people with visual impairments, and he actually gives courses on a frequent basis. So if you have patients with low vision, you can refer him to Muhammad. And another initiative that was started by our hospital, KKESH, which is called OSIFHA. And the idea of OSIFHA is that some of the content that's available online is not described for patients with low vision. So what this initiative does is it asks volunteers to come and participate in describing some of the content that's available online so that it becomes readily available for patients with low vision. So moving on from low vision to glaucoma, one of the very useful apps for glaucoma patients is called Glaucoma Notebook. And this is basically a diary app. What it does is it gives the patient a screen where he can register or document his IOP measurements over time. So whenever he has a visit with his ophthalmologist, he checks his pressure and he records it. And then the app over time gives a line chart which demonstrates which eye has got stable pressure and which eye is fluctuating. And this is particularly useful when you're following patients that are far from you, and in between your own visits, the patient sees someone else for IOP check, so they can document the IOP measurements and show them to you whenever they come. And another feature that's also within this app, it's a medication reminder feature. So you type in the medications that you're taking, and you set an alarm on whenever you want to take them, and then it will notify you immediately. Another very useful app for glaucoma, and as well as patients that are that have glaucoma but are also following for other diseases, it's called MediSafe, and it's basically a medication reminder for all sorts of medications that you can think of. If a patient is diabetic, hypertensive, as well as having glaucoma and any other conditions, this app is useful for the patient, in which it in one place it gathers all the medications and reminds the patients about them. The third app about glaucoma is pretty basic, but from my perspective is the most useful one. It's basically an OHTS calculator. It's a single screen app actually. You open it whenever you have a patient, and this is probably for glaucoma specialists that are listening. Whenever you have a patient that has high intraocular pressure and you're not sure about his glaucoma risk, just open the screen and type in those indicators that we usually use to calculate the risk, and then the app, according to the OHTS calculator that we know, will give you the relative risk for this patient. Before moving from glaucoma, I thought I'd like to mention one of the things that I came across preparing for this presentation, which is utilizing virtual reality to perform visual field tests. As you know, performing visual field testing in glaucoma now requires a big setup of having the Humphrey or whatever visual field machine you have. But there's a group from Greece that have tried to connect a virtual reality glass to a laptop, and they gave a patient a button to press, and this is what they've shown to the patient. So they start with one field and then move on to the other. And this is how the printouts look like, comparing the virtual reality printout to a standard Humphrey printout. This is probably still under development, but it would be very useful if it gets integrated within clinical practice. It will make the adoption or the utilization of visual fields more and more. So I'll stop talking about glaucoma and move on to another specialty, which is strabismus and amblyopia. And this is one of the apps that have gained attraction over the past couple of years. It's called Go Check Kids, and it's an app that's based on the principle of photo screening. And for those of you that haven't heard about photo screening before, the idea behind photo screening is that in schools where kids are not checked, what they do is they take a photo of a child's face, and according to the red reflex, the app estimates whether or not this child has amblyopia risk factors. And it's got a reasonable sensitivity and specificity, but it's still not as accurate as standard examination, of course. Another useful app in clinical practice for strabismus specialists is an app called Eye Tilt. And what Eye Tilt allows you is to measure the head tilt of a patient, and it actually gives you the measurement of tilt in degrees. And the idea behind this app is that it utilizes the gyroscope that's built in the iPhone. So for example, if you have your own iPhone and you flip it from vertical to horizontal, the screen immediately changes. And that's because of a built-in gyroscope within the iPhone. Similarly, this app opens your camera and you can put the patient's head, and it gives you a measurement of how much in degrees the head is tilted. And it will allow you as well to monitor patients. For example, if you've performed an intervention and you've recorded the amount of tilt pre-op, you can follow it objectively post-op. Another useful app is called 9Gaze app, and this is useful for strabismus specialists as well as probably people in oculoplastics. Sometimes when you want to take 9Gaze photos and display them in a presentation or whatever, it's difficult for you to gather all 9 photos in your photo studio on your phone and then use a photo editor to arrange the photos, which is superior, which is inferior, etc., etc. What this app allows you is it walks you through the 9 photos, and it tells you in each time whatever to instruct the patient to look straight, to the right, to the left, and at the end it automatically gives you the outcome, which is 9 photos all together in one shot. Moving on to amblyopia management, of course, one of the most cumbersome tasks for a strabismus specialist as well as families of patients with amblyopia is to ensure compliance with amblyopia. And I'd like to share with you a story that was actually promoted in Google's developers community. This is a child, her name is Amani, and her father is actually a software developer. And Amani was diagnosed with amblyopia, and her parents had difficulty in following or complying with patching. So what the father developed is actually an app that you find available on both stores, iPhone and Android. The idea is that it tracks patching behavior. So you enter the kid's name, and then you click on start whenever you've started patching, and then you click on end whenever you've ended. And then it gives you a log of each day and how many hours you've patched so far. And then at the end, after 30 days, it gives you a whole overview of the past 30 days and how many days the patient has patched and how many days haven't. So this gives you an idea about the compliance of patients to patching. Another hot topic that I'd like to touch before moving from strabismus and amblyopia, and I guess a lot of you have heard about this before, which is using 3D games for amblyopia treatment. And the idea behind this concept is that people have predicted that if you give patients 3D glasses that split the input from one eye as compared to the other eye, it can suppress the non-amblyopic eye and stimulate the amblyopic eye to watch further. And if you search the App Store, you'll find 30 or even about 40 games that are talking about this. But the issue is that none of them have actually been, or majority of them haven't been actually validated. And when I searched the literature, I found 5 randomized clinical trials that have compared gaming versus different interventions. So some of them have compared gaming versus no gaming, while others have compared gaming versus patching. And this is my single slide, very quick meta-analysis comparing all the 5 studies. You can find that the one that showed the positive result was only one that was published in JAMA in 2016, in which gaming was actually superior to patching, but all the other 4 studies didn't show any benefit of gaming. Of course, there's a difference in methodology. Some of them targeted children less than 7, others have targeted children less than 12, and it's probably not a place to discuss those studies in depth, but just to give you an overview that this is something that people have been discussing, and this is the study that showed positive result. They tested a game called Dig Rush in collaboration with a company called Ubisoft. For those that are interested in gaming over there, they probably know Ubisoft. So the blue line here demonstrates patching, where the orange line is patching and the blue line is binocular gaming. And you can see the improvement of VA in the first 2 weeks down to 2040 over here, but in patching it remained at 2050, and there's a difference that's statistically significant. Of course, this was a crossover trial, so they switched regimens, but those that started with gaming eventually regained better visual acuity compared to those that started with patching. And after this clinical trial, this group actually evolved into a company that's called Amblyotech. And I've been following the company for a couple of years. I thought that they would introduce a product in the market, because they initially commercialized a product that's called Amblyotap, and it's basically a tablet to treat amblyopia. But they haven't produced anything there wasn't any activity in their newsletter for a couple of years, until last month, Novartis announced that they have acquired Amblyotech. So probably they're working on something that we will find in the near future. Last condition that I'm going to talk about is dry eye. And who over here doesn't have dry eye? It's a very common condition in our region. Very useful feature that's built in the settings of your smartphone, whether iOS or Android, is the screen time. You've probably heard about it. It was introduced, I think, a year or more ago. So you basically go to your settings and check screen time, and it tells you the average time that you have spent on your phone over the past week. And a funny thing that I usually do if I have a patient that complains of of dryness is I ask the patient, how many hours a day do you roughly use your phone? And they usually say, well, 1 hour, 2 hours. And then I ask them to take their phones out and open the settings and show me how many the average hour or the average screen time is. And what I usually find is that they spend 5, 6, or even 7 hours on their phones. So this is probably useful to follow patients. Whenever you have a patient with dry eye and you ask him to reduce screen time, you can check his phone whenever he comes to you in the clinic. Another useful app that has been developed by Allergan, which is the OSDI questionnaire. And those are certain questions that the patient answers, and then it gives you a score and tells you whether or not you are likely to have dry eye. And this is particularly useful when you have a patient that's emailing you or contacting you distantly and telling you that I think I have dry eyes. You can send them this questionnaire to answer so that it gives you an idea. And the last app I'm going to talk about, which is also very useful, which is the break and blink reminder. As you know, we always tell patients every 20 minutes, take a break for 20 seconds and look at something distantly for that's 20 feet away, but it's difficult to remember to take a break every 20 minutes. So this is very useful in which it gives the patient a notification to take a break. I've tried the app. It's actually a bit annoying because it constantly gives you notifications, but it's something that you can suggest to your patients. So we're done with the first two categories, which is clinical encounter and management of disease. I'll move on to things that can help you in the surgical theater. Of course, all what I've said about photography and adapters also applies to surgery, so I'm not going to go through this. Two useful resources probably most of you know about, but I'll just touch on them, are YouTube and iTube. No one doesn't know YouTube, but I'll talk about iTube, which is basically an online video library. And many ophthalmologists have collaborated for the content that's over there. So you can check it regularly. You'll find very useful surgical techniques on iTube. Next thing that I'm going to talk about is some of the calculators that you can find online that make your life easier in the OR. Let's say, for example, you want to implant an IOL in the sulcus instead of in the bag, and you don't want to bother your mind with doing any calculation. Those calculators make it very easy for you. One of the very useful calculators that I use is called the Panacea IOL calculator. And this was actually developed using artificial intelligence and big data. So whatever data you feed into the software, the developer takes it and utilizes all the data to improve the future outcome of the formula itself. So it takes a lot of measurements when you're doing IOL calculation through this app, including the lens thickness, age, etc., etc. Those of you specialized in cataract surgery and IOL calculation are probably better than me in talking about this, but this is a very useful app that you can have a look at. Other things that you might need to calculate, for example, if you're doing LRI, toric IOLs, those are some of the apps that might be useful for you. Very interesting use of smartphones is axis marking. If you're implanting an IOL, a toric IOL, what you typically do is go to the patient in the holding area, put a speculum, binoxenate, lift his lid, and apply a marker. Well, this should be in the past. This is how you do it in the 20th century, but this is how you should do it in the 21st century. So basically, again, just like what I said, and when I was talking about eye tilt, and that the iPhone has its own gyroscope, you can utilize that gyroscope to mark your axis. And two famous apps are available, and both of them have been studies, and you can find the publications in the literature. One of them is called iToric, and it's there for Android devices, and the other one is called Toricam, and it's in there in the Apple Store for iOS. And studies done on those two apps find that those two methods are superior to manual marking. And one good utility that you can use in these apps is not just in OR, but let's say you have a patient post-op and the refraction has changed and you want to make sure whether or not the IOL is properly centered or aligned. You can dilate the patient and use this app to accurately measure the axis. So it's also useful post-operatively. Last thing that I'm going to be talking about in video editing is in surgery is video editing. Of course, people think that video editing is a sophisticated thing and you need a lot of gear, just like this photo, when you only actually need your phone to do so. So any basic video editing app that can trim, adjust speed, reorder clips, add a voiceover, add images, text, and transition can do the job. And there are actually plenty of apps over there. I'm not going to go through them in depth. You can try them. Most of them are free. I would suggest that you start with either Viva Video or KineMaster. Those are easy apps to use. And then if you want to go up a little bit, you can purchase LumaFusion, which is a bit pro. We still have about 20 minutes, so I'll just try to speed up a little bit. Fourth use is productivity. And I'll just go quickly through apps that help you in your day-to-day practice. And the way I usually talk about apps for productivity is demonstrating the apps one by one. And I found this way a bit confusing for audience. So I thought in this lecture, I'm going to change it a little bit. I'm going to demonstrate questions or utilities. And then in each time, I'm going to be talking about an app that serves that purpose. So the first purpose is that you might ask yourself a question: how can I keep all my documents within my reach? And this is probably something you all know, but I'll just touch on it quickly, which is using cloud file storage. But and there has been a rumor that with the reduced pollution with the COVID outbreak, our files on the cloud are at risk because they are partly exposed, but don't worry about that. They're save. So I'll just show you how I organize my files. I've got all my files that have all the presentations that I've done for the past 6-7 years. They're all there within my phone. And that I'll just give you a day-to-day life example. Sometimes some of my colleagues ask me about a presentation that I have given about 3 or 4 years ago. So it's all there on my phone. I open my Drive app and I go to case presentations, and they're all organized by date, and I can even find a presentation that I gave back in 2014. The second utility or productivity tip is keeping track of your patients, OR list, etc., etc. And the app that I use for that is called Google Sheets. Probably most of you have heard about Google Sheets. And the beauty of Google Sheets is that it transfers the data that you have into a spreadsheet where, for example, if you have an OR list, you can arrange your OR list. If you have a waiting list, you can arrange that. And it's very useful. Some people find it difficult in the clinic to scroll through a spreadsheet and find a column to enter data. So a very useful add-on for Google Sheet is called AppSheet. The idea of AppSheet is that it transfers or transforms the spreadsheet itself into a form. So instead of using a spreadsheet to enter data while you're in the clinic, you can use a form, and then it automatically gets transferred to your Google Sheet. You can view it at any time. The third tip is taking quick notes on the go. Let's say you saw an interesting case, you want to take note of it. Someone gave you a piece of information, and then you want to read about it later. One of the very useful apps that I use is Google Keep. I suppose some of you are using the Notes app that's already built in within the phone, but the beauty of Google Keep, and I'll show you how I use it, is that it allows you to classify notes according to labels. So let's say I've written this note, I go to a section that's called labels, and when I click on labels, it gives me a classification of where I want to enter this note that I've just taken. So I want to put it under interesting cases. I just stick on interesting cases. And then when I go to my home screen and I click on interesting cases, all my notes that I have entered under interesting cases are shown over there. Next thing I'm going to be talking about is how to manage teams and projects. Let's suppose you have an awareness campaign or whatever project your department is going to conduct. One of the very useful apps that you can use is called Asana, and it allows you to arrange tasks amongst your teams. And we know that in every job site, although sometimes the team is big, but you probably sometimes have one of those. So one of the guys usually does 99% of the work, and then you have another guy that doesn't have an idea of what's going on the whole time. Then you have a third guy that says he's going to help, but he doesn't. And then the last guy is the person that disappears at the beginning and doesn't show until the very end. So in order to get rid of those stereotypes, Asana allows you to arrange your tasks specifically and handle each task to a specific person and give it a time frame. Final app that I'm going to be talking about is very useful from my perspective in research projects. So what it does is, it's called TeamGantt. And what it does is that it gives you an online Gantt chart. So whenever I have a research project, I want to plot it against time, I put down the steps that I have in this app. So the IRB approval, data collection, etc., etc. And then I can monitor over time, just like you do in a handwritten Gantt chart. So I monitor over time each step and how much I've completed from that step. And you can also, of course, view it from your phone so that you can have a general overview about all your projects that are going on and each project, what have you reached in it. So the fifth part that I'm going to be talking about is connecting with patients. And of course, with the introduction of electronic health records, the time that we have in interaction with patients is very limited. And sometimes we can compensate that by connecting with patients outside the clinic by utilizing our smartphones. When I initially started connecting with my patients, what I started with was giving them my email. But then I found out that most of my patients actually either do not use email or are not comfortable with going in and sending an email to me and then waiting for my response. They want a more prompt interaction. So, and as you know, people over here, at least in our region, utilize WhatsApp on a daily basis. So this was the second step that I thought about. But then I thought about my own privacy. I didn't want my private number to be sent to all patients, and then whenever I want to take a break away from that, I wouldn't be able to do it. So what I've used is business WhatsApp. Some of you have probably heard about it or used it, but for those of you that haven't used it, I'll show you how I use business WhatsApp to connect with my patients. And the features that make business WhatsApp useful are that patients are very familiar with WhatsApp. You can link it to a different phone number, so patients will not be able to reach your own private phone number. You can use two WhatsApps, separate WhatsApps on the same device, and you can set a business profile. I'm going to show you quickly how my business WhatsApp looks. So this screenshot is from my own phone. I have two WhatsApps. One is personal WhatsApp, and the other one is the business WhatsApp that I use to connect with patients. And I've connected to a separate phone number, not my private phone number. And you can also add a logo, your name, whatever. And then you can use it as you use your regular WhatsApp. And you can actually also add quick replies. Let's say you want to tell a patient that you've did an operation to him 3 days ago. After 3 days, you want to send the template to him that I hope you're okay, you can do that. This is a very useful feature in business WhatsApp. And an additional feature is called the Chatbot. You've probably interacted with one of those bots through WhatsApp of some of the companies over there. This is very useful for those of you that are running private practices. If you want a chatbot for your own practice where a patient can book an appointment or check his appointments, etc., you can add that feature to you. But for personal use, chatbot is probably not that useful. Next thing that you can connect with your patients, which is probably something controversial, is social media. I'll just touch on it. I'm not going to go in deep. I don't consider myself as an expert in social media. Probably there are people that are better than me in this regard. And then finally, teleconsultations. And I'd like to shed some light on some of the apps that are available in our region that can provide teleconsultations. Those are basically Uber for doctors, if you may say. So what those apps allow you is that you open an account and then you enter all your details, you create your own profile, and then patients go in, use those apps for consultations. So they pay money to the app and you get a cut of that money for giving that consultations. It's probably not useful for our specialty because we strongly rely on clinical examination and looking at the patient's eye. It's probably more useful in specialties such as psychiatry, dermatology, family medicine, etc. I've never used those apps, but I have a lot of patients contact me on Twitter asking me for consultations, and those are the kinds of photos that you get. Don't worry, this is not the patient's photo, this is my own eye actually. The images that you see through teleconsultations and ophthalmology are not that clear. That's why it's probably difficult to answer patients' consultations. Finally, I'm going to wrap up with continuing medical education. Every doctor has concerns how to stay up to date with his field, how to read the journals on a frequent basis, how to become notified of what's going on within my specialty. I'm going to go through quick tips that may help you. Those are some of the apps that are very useful for download. The famous Wills-Eye and Mass-Eye apps. The AAO One Network also have an app that you can download. I'm not going to go through those three apps because you probably already know about them. I'll shed some light on an app called Eye Handbook, which is a very useful reference that I use. So they've got a whole library that contains a lot of resources. For example, in the media library, they have videos, audio, and under video, for example, you can see all sorts of lectures that are free to watch. They also have an atlas. So if you wanted to quickly find a photo for a specific condition, you can go to their atlas and search for it. Another useful feature within the Eye Handbook app is the medications section. Let's say you wanted to give Diamox for a pregnant lady and you're not sure what pregnancy category is it. You just go to Eye Handbook and search for acetazolamide, and you can find all the details that you need about this medication. They also have a manual, which is basically written information that you can read about different types of diseases and conditions. The second thing that I'm going to talk about is keeping up with research within your field. Let's take a imaginary scenario that you're discussing a case with one of your colleagues, and you tell him that, well, I read this piece of information in a paper that came out last week. And people become astonished and think, oh, wow, you are really up to date. And you can brag in front of them, telling them that you are too smart. Well, in reality, it's not about being smart. It's just about being organized. So one of the apps that I really use is called an RSS feeder, or a journal reader. It basically brings all the information or all the feed from different types of journals, and then it gathers all these things within one account, and you can go to that account and read all different journals. The app that I use is called Feedly, but you can find different apps serving the same function. So you can search for RSS readers or journal readers, and you can find many. I'll just quickly go through my account. So if you open an account, you go to add content, and then within the search box, you type the phrase or keyword that you want. Let's say I entered glaucoma, and then it shows you all the feeds about glaucoma, the Journal of Glaucoma, the Glaucoma Research Foundation, etc., etc. And you choose whatever you want, and then you'll have your own feed of all journals. And this is actually my collection. You can see here cornea, JAMA, retina, British Journal, etc., etc. And you can, as if you are reading through your Twitter feed, here you view the feed from all different journals that you are following. Another tip that I'm going to be talking about is keeping your thoughts organized. The problem nowadays is the abundance of information. You read a lot of things, and you come an hour later and you have difficulty remembering whatever you've read. So let's say you're going through Feedly and you found 3 titles. First title is useful for a presentation that you're going to present next month. The other one is useful or related to one of your research projects. And then a third article is about a surgical technique that you're going to try in OR next week. And then after a week, you'll have difficulty remembering where you read that article about, let's say, uveitic glaucoma or whatever. So what I do to organize my thoughts and organize the references that I go through is use Mendeley on my phone. Of course, all of you know Mendeley, the app that we use on our laptops to organize references as a reference management system. But another useful utility of Mendeley is to use it on your phone to organize your thoughts. So whenever you read an article and you want to place it somewhere to come back for it later, you go to share, you click on Mendeley, and then you will see that tick button in red, and it will automatically get added to your Mendeley account. So after it gets added to your Mendeley account, you just go to this small file icon, and then you arrange your content or your data in files, and then put that reference or that page within the file that you want to come back for it later. This is the end of all the resources that I'm going to go through. I'll just touch on some of the references or some of the resources that I frequently use to learn things online. So TED, Udemy, EDX, and Coursera. Those are useful apps that you can use to learn new things whenever you want to learn a new skill. Go into one of those, and you'll find tons and tons of courses. And this is a figure that I usually cite whenever I have a presentation. In order to improve yourself, you need to jump out from your comfort zone and reach where the magic happens. So as I've promised, I've gathered all the references that I've talked about in an infographic. You can see it over here. It's called Useful Apps for Ophthalmologists. You can save that infographic in your phone and come back to it whenever necessary. I'm going to post it on my Twitter account, and I'll post the link over here in the chat section so that whoever wants to take a photo or to download this infographic to his phone, you can follow that link. And for those of you that don't have Twitter accounts, or if you cannot click on the link that I'm going to share right now, you can just email me and I'll be happy to share it with you. I've reached the end of the presentation, and I'd really like to thank the Glaucoma Division for inviting me for this talk, and I'd like to thank all the attendees for staying up until the end. I'm really happy to know that people are really interested in something that I have to say. So thank you very much.
Thank you very much, Dr. Adi. That was really excellent, very full of information presentation, and I can see how much time and effort you put to bring this to us. That was very engaging, actually. So before we receive the questions from the audiences and the attendees, let me drop one or two of my questions. With the current universal situation of COVID-19, most of the high standard and well-equipped hospitals and centers, they are shifting to the virtual clinics or virtual service, if I can say. So how do you think we can, and KKESH is one example, by the way, we already started that. How do you think we can conduct such a service in an excellent way?
Thank you very much for your comment and your question. That's a very important point, and actually we can take KKESH as an example. There are many apps through which you can utilize to get connected with your patients. So video conferencing through Zoom or Skype will allow you to see the patient in person. Some of the apps that allow you to perform some steps in the clinical exam, as I've illustrated at the beginning of the presentation, can be used to perform some of those tests. Let's say if you want to check a patient's acuity or have an idea about a patient's acuity, you can check that. And then finally, you can use some of the apps to monitor patients as well. As I've mentioned, if you have a glaucoma patient, you can give him the glaucoma diary app and ask him to go to a local ophthalmologist and check his pressure. If you have an AMD patient that you want to monitor, you can give him an Amsler grid on his phone and ask him to come only when he notices any changes in his vision. So this is how you can utilize such technologies in our current situation.
So this would take me to another question, which is already posted by Dr. Salwa Al-Hazza. I'm so happy to have her with us today. We're concerned about when do you think the patient can take a photo from his smartphone and send it to you? Is that possible? Any applications that he can use?
Well, unfortunately, we're not there yet. But what I see in the near future is something similar done in another arena, which is home testing. Some companies in the States, what they do is, let's say you want to do a hemoglobin A1C. So what they do is they ship the test to you, or the test kit, and then they show you a demonstration on how to take a blood sample from yourself, and then they show you how to package it, and then you package that shipment and send it back to the lab. And by that way, you have performed an in-home HbA1c test. So in ophthalmology, what I see in the near future is that probably we can reach a level where we can ship something to the patient, let's say a smartphone attachment, and then he can take a photo of himself or his eyes using that attachment and then send it back to us. And then the information gets stored through an app or whatever. That's probably something that can be presented in our community in the near future. Let's hope so.
Okay. So you already mentioned a few of those applications that we can use in our field, but if I can just make it short for myself at least, can you just tell us 3 applications that each ophthalmologist should have on his smartphone, or like must have applications?
Well, if I wanted to summarize 3 must-have applications, I would say 1, an application to read your journals, such as Feedly, so to stay up to date within your field. Number 2 would be an application to organize your clinical work. For me, I use Google Sheets to arrange your patients, etc., etc. And then number 3 is an application to communicate with your patients, such as, let's say, for example, business WhatsApp. So from my perspective, this is probably, these are the 3 most important apps.
We have another few questions from Dr. Salwa Al-Hazza. Maybe we can give her the, Ali or Majid, if you can just allow Dr. Salwa to be engaged with us.
I've actually invited her a couple of days ago,
Okay,
and I'm really
perfect.
happy she came.
We are so proud that she's with us. Dr. Salwa, are you in?
I think she has to raise the hands in order to allow her to switch on the microphone. It's Dr. Diego.
Dr.
Speaking.
Salwa, yeah, would you please just raise your hand so we can allow you to go in? Any other comments or questions from the Dr. Conrad, Dr. Ramalik?
Dr. Salwa, you can speak now.
Okay, great, thank you.
Hello?
Hello, Dr. Salwa. Hi,
great.
we can hear you.
Thank you. Thank you. Adi, this was really very informative. I truly thank you. The hour went by so fast. We didn't even feel it, but I'm really interested more so, and I know you said it's something to ship to the patient and then he ships it back. You know, this is going to be very difficult. We face a lot of problems when we try to get the blood tests for our patients, and I'm really excited, and I'm hoping that we will hear from you or through KKESH soon, how an application where a person can take their photo. And so that is really going to make a really important difference. My second question, you showed one application that showed a very low, well, I consider it low because anything below 90 to me is low sensitivity and low specificity. Were these false positives or were these mainly false negatives? Because I don't mind being over-referred. I'd rather have a person over-referred than a person underdiagnosed. And my last question was, when you mentioned the business WhatsApp, you said, do you need to purchase another number, or is it your own personal number, but it's actually not revealed to the patient you want to deal with? Thank you very much.
Thank you very much, Dr. Salwa. I'm just want to go back to the slide about, I think you were asking about Go Check Kids. To answer your question, the positive predictive value was 57 and then the negative predictive value was 83. So no, we are losing patients. It's not that accurate. The other issue that you talked about, which is shipping something to a patient and then having it sent back to you, it becomes easy when you have a good logistical system. Let's say, for instance, in the United States, that's why in-home lab testing is very common in the United States. You've probably heard about a company called 23andMe. So this is a company that allows you to do DNA testing. They ship the swabs to you, you do it at home, and then they take it back. Unfortunately, over here in the kingdom, still, as most of you shop online, you face difficulties with companies. So that's why we still, the infrastructure for performing such thing is not very well established. We hope to see that in the near future. Answering your third question, which is about the business WhatsApp, yes, you have to purchase a separate phone. So what I did is I purchased a separate SIM card just to obtain the number, and then I activated the business WhatsApp on that SIM card, and then I've kept that SIM card in my drawer. I'm not using it, but it's linked to that business WhatsApp account.
Thank you so much. Any further questions?
I just wanted to ask one question for Adi. Adi, thank you. We always enjoy your tech lectures. Very nice. So, you know, I've tried taking pictures, anterior segment pictures with my phone, and it's particularly useful when the slit lamp camera here is broken. And, you know, what I found difficult is the camera aperture is very small, right? And then, unless it's exactly coaxially aligned with the eyepiece, you won't get a good picture. So do you have any tips for that?
So two things that you can do. Remove the attachments. So some slit lamps have attachments that are used for human orbits to rest on. So you can remove that attachment and then the aperture will be big enough. The other way you can solve that issue is just to zoom in within your phone in a manner that fills the whole screen. But if you zoom in, you will jeopardize some quality. So if you can remove the attachment that the attachment that's used for resting your orbit, that will be probably a more optimal solution.
Thank you.
So I think we should conclude. I'm afraid we have a lot of questions that were not answered, but we are running behind the time. Thank you so much again, Adi. We might invite you again to speak about artificial intelligence in future. What do you think?
Do we have
Dr. Al-Rajhi. Hi,
do we have any other activity after this grand round that is for the same group?
I have the division chairs meeting, unfortunately, at 3 o'clock, and I have to leave. Maybe you can continue.
I think if people are interested in the questions and they want answers, if you don't mind, Dr. Ahoud, we can take over.
Sure,
and
please.
Adi doesn't mind, we'll keep him for another 15 minutes.
Sure. Thank you so much. Thank you again, Adi.
Thank you very much, Dr. Ahoud. And I think as you've seen probably from the chat and the comments, it's a great presentation and something that all of us really need and would be very useful. And as Dr. Ahad says, I guess we need now an application to organize all these applications.
Yes, and we need Adi again just to explain how to use those applications. We reached 250. We reached 250 participants. That's a great number. Thank you so much, everyone, and please stay safe. Thank you. Bye bye.
Thank you. The one thing that we are trying to do now at KKESH, there are several of these companies, as you've mentioned, that have sleeves or covers for mobile phones that you can apply to the slit lamp and to use. I used to have 2 of them, and one of them, as a question also, as an answer to Dr. Rizwan, you had to remove the eyepiece from the slit lamp. So if you remove the eyepiece, but this is something that I had a long time ago, I'm not sure if it still functions. And you just put the camera with the adapter. The adapter is part of the cover of the phone. You put it in place of the eyepiece, and it will take perfect pictures. What we're trying to do at KKESH is the same as Adi has explained, to find at least 2 types of covers, one for the most common iPhone and the other one for the most common Android phones available, and have them available in the clinics. So if doctors want to use them to take pictures. The only problem that we have with this is that we will not be able to have official documentation of these pictures taken. It will end up that every doctor will have his own pictures, but they will not be in the file. There is no legal evidence that the patient accepted to take his pictures. And there is no, for future follow-ups, these pictures will not be in the file of the patient. So this is something to think about, and probably we'll have to find a way around it. But as you said, it makes it much easier. I'm not sure, do you see the questions, Dr. Adi?
Yes. If you allow me, I'll start going through the questions and answering them. This is a question from Mirna Castro. I'd like to say hi to Mirna in OR. She is asking, since her iPhone becomes full of storage, medical documentations, pictures, does it have an automatic saving somewhere that can back up your files? So this is very important. Losing files is a very common scenario that happens to people that I've seen around. And there are some useful tips that if you follow, hopefully you will not face such a thing. First of all, always on a monthly, I do it on a monthly basis, but you can do it every 3 months. Have a copy of whatever's on your phone somewhere else. You can do it either on the cloud, and Apple gives you that service on iCloud, or you can do it, the way I'm doing it is having a copy of my phone on my personal desktop. So this is one thing. The other thing is that sometimes the phones jam whenever you're updating your iOS version. So if you have a software update on your phone, whether it's an Apple or Android, make sure you take a backup before updating, because sometimes it jams and then you lose all your data.
There is the questions and answers sections. Is it visible to you, Dr. Ali?
I'm going through the chat.
The Q&A?
I'll go through the Q&A.
I think you've answered the questions of Dr. Salwa.
Dr. Sausan has also
question of Dr. Sausan. She's basically asking if you want to find an information and it's available in several apps, is there a way to search for them without opening every application separately? Because she says that some applications have overlapping or similar functions.
This is something that actually you as a person, this is how I do it, decide where to store different types of information that you have. So for example, my photos, my lectures are always on Google Drive, so I know where to go for them. All my references, all the articles that I read, all the references that I use in my research projects are on Mendeley app. So I know where to go and fetch for them. It's better to have 2 or 3 apps and you're maximally utilizing them than to have 10 or 15 apps and you don't know which is where. So this is something that you as a person, as an end user, decide each app what you are going to use it for. Because as you mentioned, Dr. Sausan, apps have overlapping features, of course.
Okay. Thank you very much, Dr. Adi. I just realized now Medical TV is reminding us that it seems the quiz is in the same setting and the same people that are with us now in the program. So we'll have to sign off, unfortunately, so that we give our colleagues the chance to go through their other activities. Adi, I speak for all. You've done a great job as usual. Very important and useful information. I've already downloaded from your Twitter account the infographics. So thank you very much. And we wish you all the best.
Thank you. Thank you.
Thank you.
السلام عليكم.
عليكم السلام. هلا دكتور، صوت واضح.
صوت واضح؟
اي نعم.
طيب ممتاز.